if you believe you can do anything. In this video, I will cover shoulder dystocia. I will talk about diagnosis, complications, and management. If you want to support this channel and see more videos like this, please like and subscribe. Don't forget to hit the bell button to be notified when a similar video is posted, and let's get back to it. Shoulder dystocia is an unpredictable and unpreventable obstetrical emergency due to impaction of the anterior shoulder behind the maternal symphysis pubis. Although most cases occur in non-diabetic women with normal-sized infants, however, a history of shoulder dystocia, an increase in birth weight, and maternal diabetes are risk factors. Complications can be divided into maternal, which include postpartum hemorrhage, as well as higher degree perineal lacerations. Symphysial separation and lateral femoral cutaneous neuropathy have been shown to be associated with aggressive hyperflexion of the maternal legs. Fetal complications include brachial plexus injury and fracture of the clavicle and humerus, which commonly resolve without any long-term complications. Other rarer complications include diaphragmatic paralysis, Horner syndrome, and facial nerve injury, but it can also cause encephalopathy and even death. It's important to be calm during the management and remember the word helper. H is for help. You might need another obstetrician, an experienced nurse, a pediatrician, or the anesthesia team in case the patient needs to go to the OR. Although episiotomy does not relieve the impaction, but it gives space for internal maneuvers. L is for legs, commonly known as Macrober's maneuver. That involves flexion and abduction of the hips, which lead to flattening of the sacrum and increase in the anterior-posterior diameter. P is for pressure, which is a suprapubic pressure that's performed by another individual. The pressure should be directed on the posterior aspect of the anterior shoulder. Most of the shoulder dystocias are relieved by the previous maneuvers. However, if unsuccessful, we can attempt Rubin maneuver, in which pressure is applied on the posterior aspect of the anterior shoulder vaginally, or wood screw maneuver, in which the baby is turned 180 degrees, which is extremely difficult, delivering the posterior shoulder. Or we can attempt Gaskin maneuver, in which the patient turns on all four, and delivery is attempted by delivering the posterior shoulder, which is now anterior. More heroic measures include abdominal rescue, which is done by performing a caesarean section and attempting to push the anterior shoulder through the genital tract, or by performing a Zavanelli maneuver, which includes pushing the baby back inside the uterus and delivering it via a caesarean section. This is extremely difficult. Don't forget to check out my books on Amazon. One of them is called OBGYN Made Easy, Don't Waste Time on the Shell, The Pearl is Inside, and the other one is for questions and answers. And the links are provided below. If you want to support this channel, please like and subscribe. If you have any question or any suggestions, please leave them in the comments below and I will do my best to address them. Guys, my commitment to you is to provide you with the latest information based on the most recent American College of Obstetrics and Gynecology guidelines. Thank you and see you next time.